that's the key thing. So, all right, so we're at our final day of the Level 3 Advanced Spine and Upper Quadrant course. We're here in Perth, and I've got a couple of participants, friends I'll probably call them as well, Monica and Erin, who have you done Level 2 as well?
Yes.
Yeah, okay. So Level 1, Level 2, Level 3. So we're at the end of 5 days. So for you guys, both being early career physios, just tell me a little bit about where you're at with your physio at the moment.
Yeah, so I'm private practice physio, more in the musculoskeletal area, and pretty much been dealing with different types of presentations, so in the private practice itself, on mine sites or sporting clubs. So so you get various presentations coming.
And I'm in private practice as well, predominantly musculoskeletal, and also work with footy team as well. So get a mix of acute and chronic conditions.
So how long have you been working as physios?
I'd say for me just over a year now.
Yeah, same, just over a year.
Yeah.
Right, so with that sort of work that you've been doing, and you've come along and done some dry needling courses, how did you hear about the courses initially?
I actually heard about it through Erin.
I actually heard about it through someone that's already done it. Yeah.
Okay, so there are other courses out there. Was there anything that made you particularly decide to do this course as opposed to other ones?
I think it's more so because someone else recommended it, so I guess word of mouth's kind of the best way to go about it.
And a few senior physios know your name and they're like, yeah, like Doug's pretty good, like he's very thorough with the course.
And in detail.
With the anatomy,
Yeah, the anatomy is kind of a big part of it, isn't it? You get hammered with that a fair bit. So given that you've done the intro and then you've done advanced courses in the lower and the upper quadrant, what's been beneficial for you to have done the advanced courses as opposed to have just done the intro course?
Well, I'd say just same thing with the anatomy. So I guess you go through different muscle areas, and clinically I find you'll go through a muscle you've done in the intro, and then there might be another muscle you're like, I'll then need that new muscle that I learnt in level 2, and you'll find that's actually been a lot more beneficial for the patient.
Yeah, I think it gives you more choices to make. So like with referral patterns, a lot of them present pretty similarly. So from the basic course, you've got a basic understanding of technique, but then sometimes you don't get the best results out of picking those muscles, but they're the only ones you know. Whereas once you go into depth, then you're able to specify this neck muscle compared to this one, so you can give your clients like the best chance of improvement.
So looking at the clients that you treated either with the intro stuff or the advanced stuff, is there one that particularly stands out for you that you thought, the dry needling really helped me?
I'd say definitely like your piriformis. That was a difference in there. Like we learned your glute mats in the intro.
As opposed to being piriformis, or?
Yeah. So I guess really nutting out the difference between all of those instead of just feeling and not.
So you're talking about the very specific way you palpate, isolate, and identify tissue.
Yeah. Also, I had a really good example with like a QL, for instance, where you might do the lower portion but still sore, and then you go into more your superficial bit off the rib, and then that cleared it.
So off the 12th rib.
Off the 12th rib. Yeah. So just those little differences like that, I find made a huge difference.
Cool.
Yeah.
All right. Well, thank you both for taking the time to have a chat, and I wish you guys all the best in your future career as physios.
Thank you, Doug.
See ya. Tell us a bit about yourself.
Well, I'm Richard. I'm from Darwin. I've got a private practice. I work for myself. I've been a physio for, I think this is year 28. Feels like 58, but 28.
Did you find out from these courses, how your anatomy skills needed to be better because of your dry needling?
Very much so.
Okay.
Very much. I thought I was pretty good at anatomy.
Yeah.
But for the next 2 weeks, I'm going to go home and revise.
And that's because?
Because I don't know enough. I thought I knew more than I did.
Okay.
And I don't know enough to be, I know enough, but I don't know enough to be confident and competent. One of the big things I've found about the last few days is myotomes versus dermatomes. Being a physio, I treat dermatomally most of the time.
Yeah, I think people don't realise that their training does make them think dermatologically, so that's a big recognition about there are myotomes.
And other sorts of tomes too, viscerotomes and sclerotomes, and But the myotomes are very important, and I can maybe do better with my clients now because I'll think that I'll look in different places.
Yeah, I think the myotome concept is that a person has a pattern of referral and we go dermatonal and what would be the root level associated with that. But knowing and understanding myotomes, you say, okay, well, yeah, that's the pattern of referral and it could be a dermatonal pattern, but there are muscles that also project a similar type of sensation, and I need to check those as well.
Big time.
Yeah.
Big time, yeah.
So of the 5 days, in that 5 days, what would you say would be one or two biggest things that you've learnt going away with back to Darwin? Obviously not very much, so we can pass on that.
I just wondered which one to pick.
Yeah. Well, that's fair enough. It doesn't matter.
I need palpation skills.
So you got better?
I've got better. And there's muscles I've not really considered before. I mean, if I work on a neck, I don't think to myself about splenius cervicus or...
Yeah. So again, we're trained, and we don't realise that we're trained segmentally.
Yeah,
we're not trained to think what muscle, and the neck is a classic. You know, as I said, until probably age of 35 or 40, you probably don't have articular problems.
Yes.
So therefore, the restrictions, the lack of movements, the things that we perceive as being a joint stiffness, is probably more just a muscular, dysfunctional tightness or whatever. Too.
I think what I'd like to do too is go away and get really, really good at this, and then come back in a year or two and do a masters.
Okay.
Do with you wherever that happens to be.
Yep.
Yeah, it's good. So it was money well spent, guys.
Well, thanks for your time, Rich. It's been a pleasure catching up with you.
It really was. Thank you very much.
And we'll see you around probably a couple of years' time then for the Masters.